think we'll just head straight to the interview. Amaya?
Hi, ma'am. The first question is, can you tell us a little bit about yourself and what exactly are you studying?
So thank you very much. So I am not studying, actually. I am a practicing doctor. So I'm a pediatrician, and my name is Dr. Divya Agarwal. And I have studied my medicine. I've done my undergrads in medicine, and then I've done my post graduation in pediatrics, which made me a child specialist. And then I have further specialized in genetic disorders. So I see patients with suspected or with diagnosed genetic problems. So I see patients, and then there is a bit of clinical research that we do with our patients, and with not interventional research. It means that we don't give drugs to them, or we don't. Sometimes we do try new treatments, but it is essentially a clinical research. It's not a lab-based genetic research. So I work at Apollo Hospitals, Delhi, and yes, that is what I do.
Right. So our next question is, how did you get introduced to the STEM field, and was there something in particular, like some event that really opened your eyes to the STEM field?
So, as a child, when I was in school, I'm going to talk about then, of course. So, as a child, I was interested in sciences always. They drew my attention, and I was always curious about learning biology, and particularly the cell biology and human biology. And so not essentially the ecology part of biology, but the human biology. And as I kept on studying and progressing in higher classes, slowly, I realized, and hopefully, just like you all might realize that this is what I would like to study further. So I did not sort of think that I will make a career out of it initially, and I did not think that I will be a doctor, but I liked biology. I liked all the sciences essentially. So yeah, I'm sorry. So I liked reading sciences, and I don't come from a family of doctors. Actually, I do not come from it's not like the typical scenario for doctors, where usually, there is someone in the family, or your parents are doctors, and that's how you get pushed towards medicine. So I don't come from a family of doctors, but as I said, that as I got inclined towards human biology and the cellular biology in particular, at that time, this is about 20 years back when I was in school. In fact, 25 years back when I was in school. So at that time, we did not have opportunities, and we did not have as many career choices readily available, and we did not have information about those career options in across fields. If I've taken science, and if I want to study science and biology, I did not know how to study further. except for either do medicine or do a bachelor's in science and then go on to do masters, maybe as a backup option. BSc used to be a backup option. So luckily for me, fortunately, unfortunately, I don't know, but I got through the medicine entrance, and then that's how the journey started. And I was introduced to this world of medicine then. And of course I loved it, because in general I enjoy reading about human biology. So the first year was all about anatomy and human physiology. So I really started enjoying the subjects that I was reading, and that's the key, I feel, for the kids to sort of further uh, that's a proof sort of, and that sort of reassures and reaffirms them that when they are reading a subject that they are thoroughly enjoying, that probably they're going to be doing well later on as well in that particular career or in that particular stream of uh, that particular stream of subjects that they are going to make a career out of. So yeah, that's how the journey started. Yes.
Okay, ma'am. So the next question is that you are in an industry which is mostly dominated by men. So why did you choose to join this? And is there something which inspired you to do it?
So medicine, I wouldn't really agree that, it's essentially not really dominated by men, except for the surgical branches, maybe. But, we would, in fact, in pediatrics, as a child specialist, I think the ratio is almost, I have as many female pediatric friends who as the male pediatric friends. So I wouldn't say that it's essentially a male dominated sort of career. But at that time when I took up medicine, now it's not, but at that time when I took up medicine, probably it was slightly skewed towards the male gender. But essentially, that question didn't arise for me, because I don't think the gender ratio was skewed enough to discourage me, sort of, because it's medicine anyway. There were plenty of females there, and even if there wouldn't have been, even if I would have chosen a career option where there is a skewed gender ratio, I feel that uh, when you like something, and when you slowly realize that you are good at it, then you gain the confidence to continue to do it. And then slowly as you move forward, and as you climb up the ladder, and leaving some of your male colleagues also behind, you gain more and more confidence that there's almost no difference whether this is I'm working with males or this is a male dominated career.
Right. So, the STEM industry is growing really fast right now, especially in healthcare. So, according to you, why should women join the STEM field? What is the need for women in STEM?
Okay. So I think that there was sort of people used to think that in medicine there will be there are no fixed hours of working, and there are so many emergencies, and there will be a lot of hard work. And so how does a woman take care of the family along with work? So there used to be things like that. But now I feel that that I'm going to talk about only healthcare and medicine, of course, not the entire STEM. So even in healthcare, I think there are more. The people have grown. They've left behind those thoughts, and they are now more willing they are more accepting, they are more inclusive, and the facilities for women in terms of, we now have a creche in our hospitals for all the nursing, for all the nurses who have small children, or female doctors who have small children. The government has done quite a bit, and there is now a maternity leave that is given, that is sort of given to be able to encourage women in healthcare. So I don't think that any of this, that the working hours or emergencies or hard work should be any deterrent to any of the girls joining medicine. And there are a few, I would also like to add that particularly in healthcare, there are also a lot of specialities where there could be still a good work-life balance, not just for females, even for boys who do not want to work as much. There are some fields they do not want to take up the careers where they have to run to the hospital during the night or take up an emergency. There are some specialities where you could choose to do this. So the as the healthcare has expanded so much, it has become more and more physician friendly as well. And now there are branches where you could just choose to take up those specialities where both boys and girls could have a good work-life balance.
Thank you so much, ma'am. Just one last question. As a woman in the science field, do you have any advice for the aspiring scientists and females trying to join the field as well?
I feel that particularly for science, medicine, research, females definitely have an edge over the males, because they are more patient. Their communication skills are much better, with which are needed actually in a lot of careers, but particularly in medicine and healthcare, because you're dealing with people day in and day out. Their communication skills are much better, they are more patient, they are much better multitaskers. And at we could just be prescribing a drug for the patient, sitting in the OPD, also taking up a call and advising the nurse in the ICU what to administer to the critical patient in the ICU, and at home who has had a bad day at school. So, we are multitaskers. So I feel that girls, in fact, have an edge over the boys when it comes to more rigorous fields like medicine.
Right. So that's it for the interview. Thank you. I think it was a wonderful conversation. I actually, you mentioned something about reading books on human anatomy. So I just wanted to ask if you have any recommendations, because even I'm quite interested in reading non-fiction books. So I'd love to pick something up.
Okay. Which grade are you in? Sorry.
11th.
Okay. So human anatomy, I mean, there are science books, of course, that subject books, which
Hmm.
we used to read in our first semester or first professional exam of MBBS, the undergrad school.